Hi everyone. I just wanted to give you your summary for week 6. I think I resolved the issue of having my giant gaping mouth open at the beginning of every video. I'll be down in the corner and you can look at the a PowerPoint slide. So this hopefully will be a little less offensive than having to see my face staring at you in the middle of the screen. Maybe we can just look at some words on the screen instead. So, uh, just want to talk a little bit about what we talked about in class through the discussions in our readings last week. It was really about vulnerable populations and how we can deal with assisting those populations through policy. So, in our readings, we talked a little bit about uh, some of my more favorite readings. There were quite a few, but hopefully, you enjoyed the readings about how Medicaid has been able to kind of evolve. Uh, Reimbursement is one of my areas that I'm really focused in, and how Medicaid's been able to evolve in some areas to really assist those vulnerable populations. There was a reading about Oregon, and there was a reading about Colorado, Minnesota, and Vermont, and how the Medicaid programs in those states have been able to evolve and kind of change into an accountable care organization to really help those populations kind of increase health, decrease cost, but really focus on more of a patient-centered approach and really help those vulnerable populations to improve health overall. And hopefully, we'll see. We've obviously seen Medicare take that approach in many areas, um, and and hopefully we'll continue to see that. It's yet to be seen what the Trump administration is going to do to some of those more innovative programs, because a lot of those started secondary to the Accountable Care Act. But we'll see what happens, or Affordable Care Act. And so we'll see. But the Accountable Care Program started secondary to the Affordable Care Act. So we'll see what happens. But hopefully the Medicaid programs will continue strong because many of those were started through Medicaid reform through the states themselves, and hopefully we'll see more and more of that. Through your uh, paper this week, you had actually chosen, and to scroll up here a little bit, through the various different state and community profiles through the CDC. You actually were to take a disparity, so some type of a health disparity, and kind of dig into that a little bit and see how you might want to intervene into that disparity. And I haven't gotten into grading them yet. I'll be doing that this week, but I'll be interested to see, kind of what your innovation is, or what your thoughts were based on the research that you did to address that disparity. Has there been policy already, and how will you further that, or did you have some new innovation that you'll want to approach that with? So I'm really looking forward to that. I know just from our discussion, which is what I'm going to talk about here in a second, everyone had some really interesting ideas on how to deal with various vulnerable populations as compared to other countries, or even just here in our country, how we could innovate. So I'm really interested to look at your papers from this week. So then, talking about our discussion, in our discussion we were really talking about health disparities and vulnerable populations here in this country, but then as compared to other countries. So really great work. I thought it was a really interesting discussion board this week, and so there's no way that we can talk about all of them. Everyone had great topics that they had brought up, a bunch of different things. Um, a lot of people talked about different prevention strategies. Australia came up a couple times because they really do a good job of focusing on prevention in some areas. They take a stratified approach to prevention based on the level of wellness of the person. So really interesting thoughts there. And then But one thing that someone else had mentioned in Australia, they have pregnancy and childbirth in very young people. Their rates are very high as compared to here, and it was interesting to kind of talk through that and how it may be a cultural thing within actually within medical education. So it's just not something perhaps that they focus on there, and some interesting discussion ensued. Um, I remember when my son was in school. My son is 20, about to be 21 this upcoming year. But when he was in school, he actually had to. Someone had mentioned, um, perhaps having to in health class or something, having to raise a baby. And my son actually had to do that in health class. So I'm not sure how many of you had to do that when you were younger, or had kids that had to do that, um, or have kids that have had to do that, or going to be doing that. But my son had to do that, and I know that's pretty commonplace. So that could be something that, although if these kids, the ages that were noted in the Australia data was actually before he would have had to do that, because he actually did it in late middle school or early high school. So would have been too late for him. Um, Binge drinking was another thing that was noted. Again, a little bit older, but young people again noted here versus Ireland, which I think was a good choice, because that's obviously drinking is a common. Um, it's very acceptable and open in their society, in the UK generally, and in the Republic of Ireland. So I think it's not as much of an issue there, but it is an issue here in our young people. And how can we deal with that? What are some strategies to try and deal with that? The one other thing, I did have somebody that had mentioned a question. I wanted to address it with South Africa. So South Africa, we did have the pleasure of having a couple of scholars here. I don't know if anyone got to interact with them. They actually were at our networking event that we had this past spring. The Ganshos, Dr. and Dr. Gansho, that were here just this past spring. And they were our Rooney scholars through our Rooney International Scholar Program from South Africa, two physicians, very, very bright folks. One works more in health economy, health policy. The other focuses on HIV and AIDS research on the risk side, so risk manager. But both are medical physicians as well, but really interesting folks. And so we got to learn a lot about their systems and how they work. And they actually have a national health system that's developing right now. It's currently a public health system that's progressing toward national health insurance, that's a little bit more effective than it is right now. Then they also have a completely private system that tends to be, I think, for about 20% of the people there that can afford it, as well as expatriates that live in the country that choose to purchase into it. And the question was raised, is this a positive system? Does it work well there? I'm going to say no, that it does not probably work very well. I think it works well for the people in the private health system. They actually receive a fairly high quality level of care based on reports from the Ganshos. But it really creates um, you have your level of care you're receiving in the private health system, and then it kind of falls off a cliff. The care that's provided in that public health system is quite poor. And I think you can probably relate it to a lot of people report that the care received under Medicaid insurance a lot of times here in this country can be poor. Even though it's oftentimes provided by similar providers, but sometimes there's long waits. Sometimes you can't get, you can't see the same providers. Maybe you can't get into the same specialists because they don't accept Medicaid. So I would liken it to a similar situation, except in South Africa there are public hospitals and private hospitals. There are public physicians and private physicians, and often they don't. Never the twain shall meet. So it's really a kind of a stratified system right now. And if you can afford the private health insurance, you buy in. If you can't, then you would be on the public health insurance. Like I said, there is a national health insurance initiative right now that they're moving toward over the next many years, and hopefully that will help to resolve some of that. One other note I wanted to make, there are many disparities here, actually, the Medicaid issue that I just mentioned, but also like food deserts. I think a couple of people had mentioned that where people here, vulnerable populations here within our own country, can't access food. There's no place to access fresh vegetables, fresh fruits. The only access to food that you have are frozen, processed, canned. There's just nothing fresh to access. So what can we do to resolve those? And actually, it's interesting here in my area, and I mentioned this in the discussion boards. There's a neighborhood where my husband's fire station is that there is no. It's an urban for my area. It's a city neighborhood. No grocery store. The closest place to buy food is a Family Dollar. Of course, they don't sell any fresh vegetables, fresh fruits, things like that. But there is a food bank that comes in once a week and provides fresh fruits, fresh vegetables, those types of things to the people in the neighborhood because it is a kind of a downtrodden neighborhood. But without that, those folks would have no access unless they were to take a bus and travel to a grocery store, which is not within the mile of the distance to not be considered a food desert. So very interesting, but once a week is probably not sufficient. They really do need to expand how these folks get access. So, a very interesting week. Like I said, I'm looking forward to reading your papers, and so upcoming lots of big stuff. But keep in mind that week 7 is our last full week, and then week 8 is a little bit short. We finish up on Friday, so keep that in mind as we week 7 is full week. Week 8 is a short week. So if you have any questions, let me know. I will be going out of town. I'll be on vacation from Friday of week 7 through the following Thursday, but I'll be working. I'll be on emails, those types of things, but I will be out of town. But please, my reaction may be a little delayed, but I'll still be on every day and working and whatnot. So have a great week, and we'll talk to everybody soon.